So, welcome to Plastico Review. We're going to go through the latest papers on breast surgery for the month of February 2017. Okay, so the first paper we're going to discuss on breast aesthetic surgery this month on PRS is actually not a cosmetic section paper. It's a paper on the breast section or reconstructive breast surgery section of PRS, and it actually deals with the use of prepectoral breast reconstruction. The paper is written by Stephen Singelove and colleagues, and it deals with the use of a prepectoral implant-based breast reconstruction. They do this on over 350 patients, and it's actually based on the bioengineered breast concept developed by Patrick Maxwell, in which he combines the use of a highly cohesive or overfilled implant with acellular dermal matrices and fat grafting to be able to avoid the subpectoral plane. Now, I think the paper is very well written. They have definitely a very high number of patients, and the reason why I'm commenting this on an aesthetic breast review is that, you know, maybe that type of reconstruction will make its way into aesthetic breast surgery. Of course, they do mention that one of the contraindications of their procedure might be the use on patients with excessively thin flaps, and meaning, you know, poor coverage of the implant. And of course, that might pose a problem to the breast augmentation patient population, which of course we know that are thinner than the normal population. No, but you know, definitely an interesting case, and it could be you know, a future application for the normal breast augmentation patient, or the combination of acellular dermal matrix with fat grafting and implants in the prepectoral plane. Now, the next paper on breast cosmetic surgery is actually a single author paper by Stephen Bresnik. I think it's very interesting. It's on the prophylactic use of leukotriene inhibitors to diminish the risk of capsular contracture rate. Now, the interesting thing about this paper is that he has found out in over 1,000 patients treated that there's a statistically significant difference between the group of patients treated with accolade, that is cephirocast, over patients not treated at all without any leukotriene inhibitor over 3 months. Now, the interesting conclusion also was that there was no significant difference between the group treated with Montelocast, which is single air, versus the group not treated with any inhibitor at all. So, you know, definitely interesting. Many of us, I normally use leukotriene inhibitors for 3 months also. And I was afraid to use accolade. I guess, like all of us initially, there were some papers, the initial papers of leukotriene inhibitors were on accolade, you know, on cephirocast, but there were some issues or some description of fatal liver failure. This paper says is that, you know, those issues with toxicity of cephirocast were really on patients with comorbidities and other diseases. So patients without diseases, there shouldn't be any problems with the use of accolade. And it's definitely more efficient than the use of just regular single air. So definitely a very interesting paper. Now, it seems like there's nothing more to see on PRS this month of February regarding breast aesthetic surgery, but actually there's a very interesting letter by Eric Swanson and a very interesting reply to this letter by Anandiva. So I think you all should read this. Now, the letter by Eric Swanson talks about textured breast implants, you know, anaplastic large cell lymphoma, and conflict of interest. So the question that Eric Swanson brings up, and he actually asks it literally in the text, is why are textured devices still being used? And he argues that definitely, you know, there's been evidence that these devices have been linked to large cell lymphoma, while smooth surface implants have not been linked up to the date to this type of disease. And moreover, he also says that there's really seems to be no aesthetic benefit to the use of textured devices, and there are also, some complications that are derived from the use of textured devices, such as late seromas and rotation when you use shaped implants. Now, the answer by Anandiva, I was expecting it really to be in the same line as the one from Eric Swanson, because he wrote on his capsular contracture paper on clinics in plastic surgery recently that there should be a concern on the use of textured devices because of their link with the appearance of this large cell lymphoma. But interestingly enough, he goes into a paragraph arguing that there's literature with sufficient evidence about the benefits of the use of textured devices. Now, it's a bit surprising because a lot of the literature that he mentions and he references in his reply to the letter, it's actually literature even from the late 90s, even mentioning the famous meta-analysis from 2006 on PRS on textured versus smooth devices on capsular contracture. This paper, although is very well done and performed, had some issues because it was based on studies from the 90s, and many of them using even saline devices in the subglandular plane. And of course, even Bill Adams in his clinics on capsular contracture from 2009, he even says at that time that there was no evidence that there was a benefit of the use of textured devices in terms of avoiding capsular contracture. Now, the rest of the papers also that Anandiva mentions, of course, we all know many of these core studies have also been criticized because of conflict of interest or commercial bias, as well as by other authors because of the methodology and the statistics employed in them. And also, many of the benefits from these studies actually have been identified to be more due to the cohesiveness and the firmness of the anatomic devices than really to the texture of the device itself. These devices are harder and they will resist better capsular contractures, and they're harder to begin with. And even Daniel Del Vecchio has coined the term Barbie doll breast to describe the firmness you get with the use of these highly cohesive anatomically shaped implants. I really understand the letter from Anandiva. He raises some very interesting points about how the industry is important. Of course, it is very important for a lot of the research we do in plastic surgery. But again, he states in his final words of this letter, and I quote, "In the meantime, if we continue to use textured implants, the data point to a much higher rate of potential contamination." So he is saying that there is a much higher rate of contamination with the use of textured devices. And then he says, to minimize the risk of biofilm contamination, we should be using the 14-point plan. So my question is, why not use the 15-point plan and just, which the 15th point would be to avoid textured devices, since he says that they are at a much higher risk of contamination. But anyhow, I think it's a very interesting discussion. It really ties very well with the discussion that Frank Lista made to Carlos Rubi's paper on the use of anatomic versus round implants in breast augmentation, and his comments on financial bias as well. And it really ties well with the latest statement by ASAPS and ASPS on breast implant associated large cell lymphoma. So I think there's different opinions. I guess there shouldn't be a right or wrong answer. Each one, Eric Swanson and Anandiva has very good points. Anandiva is probably the person in the world with Bill Adams that knows most about capsular contracture, and definitely his research is the one that's providing most of the knowledge we have right now about this very complex problem of implant-associated large cell lymphoma. So definitely very experienced surgeons making these letters, and I think you should all read them and just have your own opinion, And moving on to ASJ regarding breast aesthetics. The first paper is actually also not on breast cosmetic surgery, but on breast reconstruction. It's actually on the use of polyurethane implants on two-stage breast reconstruction. The paper is by Stefano Pompei from Rome, excellent plastic surgeon, and with a lot of experience with the use of polyurethane implants. They only have an overall capsular contracture of 8% in over 90 patients they studied for 9 years. And they actually, when they stratified between the irradiated and non-irradiated, they did have a difference. I think it was close to 11% for the irradiated group and around 5% for the non-irradiated group. So, it's actually pretty good rates for breast reconstruction with implants after radiation. And moving on with other papers on ASJ, there's another one dealing with breast fat grafting, but actually we're going to discuss that in the minimally invasive procedures and cosmetic medicine, because it actually deals with different harvesting and grafting methods in order to improve survival, not so on the actual use for breast augmentation. There's another 2 papers on the nipple this month of February in ASJ. One of them is actually on the long-term results of nipple reconstruction techniques, again on breast reconstruction, not on breast aesthetics, but it's actually an interesting paper that really sort of demonstrates what we have, what we all struggle with, which is long-term maintenance of the projection after nipple reconstruction. And the other one is actually a letter from Eric Swanson, once again, regarding the unreliability of the nipple as a marker of breastosis. It's actually directed to a previous paper by a Dutch group, actually written by a medical student from Erasmus University in Rotterdam, the Netherlands, Ben Eek. And it's an interesting paper, it's an interesting read, and actually the Dutch group does give a lot of comments and replies on why they think that their method is valid to evaluate breastosis. Eric Swanson does comment that their method is very similar to Paul Renald's classification of breastosis. But nonetheless, I think it's an interesting read regarding breastosis, and both authors, Eric Swanson and Eek, make very valid points to defend their arguments. Okay, and that's all for aesthetic breast surgery for this month of February 2017. And I hope to see you next month to review the latest news on aesthetic plastic surgery. Thank you.